Hi everyone, my name is Zachary Sixbey and I am a medical lab technician, or soon to be a medical lab technician, for North Idaho College's Medical Lab Technology program. And the purpose of this video is going to be to demonstrate how to operate the Siemens Clinitek Status Plus for urinalysis. In this video, we're going to go over just QC procedure, how to use the machine and how to interpret results, as well as how to do the manual method of reading the dipstick as well in case your analyzer goes down. For our specimen type, we're going to be using a clean catch urine sample of fresh urine. And for storage condition for that, typically for refrigerated urine, you can keep that up to 7 days, but that's going to change depending on what facility you're working at and what their standard operating procedure is going to be. And so we will go over that in this video. Thank you. Just turn on our analyzer. We're going to hold down the power button, and then we get our startup screen. All right, and it's going to perform its system diagnostic test. So this is just a startup that it does when you turn it on. So we are just going to wait until that loads and on to step 2. All right, so our analyzer started up. So we're going to do some QC first. Of course, we always want to do QC before we start any tests for the day. So we've got our dipsticks here and the lot. We're going to check the lot and the expiration date. These don't expire until September 30th, so we're good on that. And we are going to get our QC started. All right, so this is our urine QC. We're using a Biorad brand. And I'm checking the lot number and the expiration. So this is actually expired, but we are on the student lab, so we're going to use it anyways. But you always want to make sure any reagent you use is not expired. It's within date. So we're going to pretend this is within date. Open it up, and there's 2 levels. We've got level 1, this is level 2. We've got level 1 and level 2. One is going to be our normal range, and then the other control will be our abnormal. So 1 is normal, 2 is abnormal, and we are going to do that next. All right, so we're gonna do some QC. So we've got QC1 here, and I'm gonna get a reagent strip. And for this, I'm gonna lay the reagent strip down. And with these, I'm gonna invert it a few times. I always like to invert the reagents before I use them, just to make sure they're well mixed. And for this, we're gonna try to get a drop on every pad without touching the end of the bottle to the reagent pads. So I'm going to get a drop, oh man, not the first one. I'm gonna drop on each. All right, I'm gonna press the side on the pad there, get any excess off, and then insert it into the analyzer. And then it'll do its countdown. We're gonna hit yellow and clear for this one. All right, and then we will wait on those results, and we will see if they're within range here in just a moment. All right, so QC level 1 results are going to print here in just a second. We're always going to take our reagent strip out, put it in our biohazard waste, and then always clean off the strip holder. I use a gauze pad. I just do a couple wipes and then throw it in your biohazard. And then we've got our QC level 1 results printing. And everything looks within range. There's no stars by our results. Everything looks good for QC1. So we're going to run QC2 next. All right, we're gonna run QC2 next. So I'm gonna grab my strip, close the bottle. And we're gonna do the same thing we did for QC1. Just get a drop on every pad. All right. Pat it on the thing, insert it into the analyzer, hit start, and then it's gonna do this countdown for that one, and we're just gonna hit yellow and clear for that one as well, and we'll get those results in just a second. So, here are our QC2 results. This should be our abnormal QC. So we will see if these are within their respective ranges. And everything looks great. We got stars next to every analyte that we need stars next to. So QC has passed. So once both QC has passed, we can do our patient sample, and we will do that next. All right, next thing we're gonna do is get our urine sample. So we're gonna get a urine cup, which are right over here. We are gonna get our urine from the patient, and we're gonna make sure after we're done, we're gonna check the patient name, date of birth, get at least 2 identifiers, and make sure the cap is completely sealed when you're done. So we've got our patient's urine sample here, and we are going to do the same thing we did for QC, except we're gonna do it with our patient sample. Instead of pipetting the sample onto our reagent strip, if we have enough urine in our sample, we will just dip the reagent pad straight into the urine. So I got my reagent pad, and I'm trying to make sure not to touch any of the pads so you don't contaminate. When I got it out of the container, I made sure to close it immediately because we don't want to expose these to light or heat. And I have checked the expiration date and the lot number. We're within date, so we're good to go. With our patient sample here, I like to give it a swirl so it's well mixed. And then we're going to, with our strip, we're just gonna dip it straight in, make sure all the pads get soaked, and then I give it a go on there to get any excess off, and we're gonna insert it into our analyzer, and we'll have those results in just a second. All right, so these patient results are gonna print off here any second, and we're gonna see if this patient is healthy, or at least if their urine shows that they're healthy. And whenever I get done running a test, I always make sure to clean off the strip holder with the gauze pad, just a couple wipes, and put it in our biohazard container. And our results are looking good so far, nothing out of range, and there's nothing out of range. So we ran our patient sample. Now we can report these results into any whether if they don't cross over into any LIS systems, we can manually enter them in whatever software that our facility is using. So thank you for watching. That is the automated Clinitek Status Plus for urinalysis. All right, so now I'm going to show you the manual method of doing urinalysis in case you have an instrument that goes down, breaks, or whatever happens and you have to do it the manual way. So on this bottle shows the color changes on each pad and what they resemble and what times you read it at. So we've got 30 seconds all the way up to 2 minutes for the leukocytes. So we are going to do that now. All right, so I have retrieved my reagent pad from the container, and next we will do the same thing we did for the analyzer. We're going to dip our reagent strip all the way in there, and I'm going to start my timer. Or my stopwatch. All right, so I'm going to dip it in there, give it a few pads. I'm going to set it down, or actually I'm going to put it up against our bottle here, and I'll start the timer, and we will look at the reactions here. I should do it this way. So about 30 seconds, we're gonna read our glucose and our bilirubin. As soon as it gets there. just a couple of seconds, and our glucose looks negative, and our bilirubin looks negative as well. So I'm going to record those results. And then at 40 seconds, we can read our ketone, which is negative, and specific gravity at 45 seconds, which is about 1.015. And then now at 1 minute, we can read our blood and our pH and our protein and our urobilinogen and our nitrates, which all look negative. And our pH looks like it's about 5. And urobilinogen, that looks negative. And our nitrite looks negative as well. And then at 2 minutes, we can read our leukocytes. That's the longest time we have to wait, and that's just in about 30 seconds here. But all my other results look good and within range. Everything looks normal. And now we just wait. In about 15 seconds, we'll have our trace leukocyte results, or trace small, moderate, or large. We'll see. It should be negative. Hopefully, this is my urine, so hopefully everything's healthy, but we'll see here in just a few seconds. All right, so our leukocytes looks negative. So everything is good with this patient sample, and that is how you do the manual method of urinalysis when you're using the dipstick method. And that is all I have today. Thank you.